Okay, great. So how are you today?
Doing well.
Okay, good. Good to see you. So Daniel, I'd like to just kind of start out with just a couple of general questions in terms of you telling a little bit more about why this program for
Right.
you. Yeah.
So I've done my research. I know that the University of Cincinnati is the
Mhm.
oldest medical college west of the Allegheny Mountains. It was
Mhm.
founded in 1819, and they've done amazing work, such as the Jonas Salk worked there to
Mhm.
make the first the polio vaccine that really was
Mhm.
responsible for wiping out polio in the Western world. And I wanted to pursue my medical education at a
Mhm.
place that is highly renowned and that can provide me with the skills I need to help others.
Mhm.
And I feel like University of Cincinnati is a great place, especially with their dual connections early medical school admissions program that can allow me to know where I can be even at this young age, even at this first stage of only being
Mhm.
an undergraduate.
Mhm. Okay. Tell me a little bit about some of the research that you're interested in there.
So I am interested in right now in two fronts in that of
Mhm.
molecular genetics and
Mhm.
also a bit in neuroscience and
Mhm.
things to do with how the, neurological disorders affect the brain and what
Mhm.
chemicals have in there. And regrettably, I don't know if anybody at the University of Cincinnati is doing those things. This is just a lack of me doing research, but
Mhm.
I'm sure people are doing those things, and I would definitely want to participate with them as soon as possible if I am accepted to this program.
Okay. Here's a just a situation I want you to just take a look at and just kind of share with me what your thoughts are about that in terms of how you might respond.
Right. So this is a good question because I'm sure it definitely does occur in a practical setting. Um, the things to consider are: would this trip interfere with my ability to help my patients?
Mm-hmm.
Would I be able to continue dealing with other representatives
Mm-hmm.
from other drug companies if I accept this specific trip?
Mm-hmm.
And I guess how would my superiors or colleagues
Mm-hmm.
feel about me going on this trip? So I could see that if I am a specialist that does not need to be in the office always, if I am not an emergency doctor, then it would be reasonable for me to go to this conference, especially if it helped me build better connections with other drug representatives and helped me get more resources that I can use to help my patients.
Mm-hmm.
Um, Also, if I am working in a setting that has multiple doctors, it's
Mm-hmm.
important that I remain remain in good standing with the other doctors and with maybe
Mm-hmm.
my superiors, so that they respect me and I can work well with them in the office. And I think that is very important because if they don't want me to go, then I value that more
Mm-hmm.
than keeping my relations where I work more than the relations I have with people outside of my workplace, because they will see me on probably a daily basis and will help
Mm-hmm.
me with my work, with my job, help me help the patients. Um, and then the third was last one was that
What about the fact that all expenses are paid? Would you go ahead and still accept it as a gift, or what are your thoughts about that?
the fact that all expenses are paid does imply that they would want me to like reciprocate on that offer and purchase or prescribe my patients to those drugs, and that does make me feel a bit uneasy, because if they want me to just use this one drug over another one that may be cheaper or more effective, and I feel pressured to use the more expensive or less
Mhm.
effective one, then I would not feel good about treating my patients, because that would be probably not following the principles of non-maleficence and beneficence.
Mhm.
So it really depends on the type of drug and the expenses that are paid. If I feel that I am being provided this gift as purely a gift, or if it
Mhm.
is being used, in my opinion, to get me to coerce me into buying more drugs from this particular company.
Okay. Okay. Um, Thank you for that. Um, there's another situation I'd like you to just give some thought to, and this is just related to how you would communicate with the patient. And so just read that and just share with me how you would share the news with the patient. And what questions would you have um, to determine how you would respond? So what do you need to know in order to respond?
So, firstly, the patient knows that he's being tested for this um, certain medical problem. So when I enter the room, I would probably ask the patient if he would
So
like to be.
is that a key question that you would have for the other person to determine how you would respond?
Well, um, I guess it is important to know whether the patient knows he's been tested for this or not. Because I know sometimes patients have a blood test that are done on them that they are unaware of, but depending on the type of test, they may or may not know whether or not they're being tested for this medical problem.
Mhm.
So,
So that's one question. Any
yes.
other questions you need to know before responding or letting the
I would
patient know?
I would like to know whether the patient has had a lot of experience in medical setting in the hospitals before being a patient, and if they're very new to this process. That's important because if someone is new to the process, they may have more difficulty in receiving the positive test results.
Mm-hmm.
Um,
What are some other questions you might have? Just to
Yeah, I would definitely need to know if the test results are something that is more serious, such as a cancer or a tumor, or if they're something just maybe like cholesterol levels, or maybe sulfate levels or something like that. That's very important because I know that patients will react very differently to different results. It seems obvious, but it's important that I be conscious of that.
Okay.
So it's when I walk into the room, I would definitely ask the patient, or I would first, if they do know about the test, I would ask the patient if they would like to be alone to hear the results. If they don't know about the test, I would inform them of the test, probably being neutral about it, and ask them if they would like to be alone when receiving the results of this test. And I know that many medical authorities suggest sitting down with your patient when delivering this news. So I would sit down and probably not very plainly, but not in a way that would misconstrue the test to be not as serious as it is. I would tell the patient about the results, and then depending on their reaction, I would either give them some time to react, or I would answer the questions they have about what should be done next in the treatment of the medical disorder.
Okay. Okay, good. Thank you. Thank you. A third one is thinking about care at the end of life. And so if you can just kind of read that one briefly as well and just tell me about kind of your thoughts about that and how you would handle a situation where there's a, question around life support.
All right. So some questions that I would have regarding this would be the spirituality of the patient and this patient's family, how they regard the end of life, how long exactly they've been in the vegetative state. Let's say several years, but if it's 3, if it's 7, that would make a difference, and also the likelihood of their recovery. And because it's a vegetative state, it's probably very unlikely, but if they have brain function or if they don't, it's important for determining what to do as the doctor. So I see that the state does oppose the removal of life support here. The family does want to remove life support, and this is the conflict between the ethics of the state and the family are very important to consider, because I could get in legal trouble as a doctor if I disobey the state's orders. I could lose my ability to practice medicine, but then again, I want to help the patient in a way that their family feels is the best choice for them. So I would definitely see if there are any ways I could go about removing life support while following the law. I would do everything in my power to try to follow the family's wishes without breaking the law. But if it came down to it, it would be very difficult to decide. But I think that I might actually remove life support against the wishes of the state. And then, because the patient is there in a coma in the hospital, I would want to know if the family would like to be there during their passing or not. Because it is important for some people, for most people, I think, to reconcile the passing of a loved one with themselves, and being there for the end of life is important to some people, and it's important as a doctor to do what I can to recognize this wish and have the desires of the family be met.
Okay. Okay. Thank you. Daniel, tell me about a situation where you've been in a leadership role and had to delegate to someone else.
So I play the double bass in many groups, and as a prolific double bassist, I guess you could say that. I am the first chair in several orchestras, and being the first chair means that I get to pass on information from the conductor to the rest of the bassists, as well as have them practice certain passages and play in such a way that I decide if the conductor does not give me any advice on how they should be played. So being in this role for several years has led me into different situations. A common one is that which we have a divided part where some players are playing different notes than other players, and so just if one part is much harder than the other, I have to decide who gets to play that part, and usually, traditionally, it's every other person. So maybe the lesser players and the better players will equally play this part, but if it's especially difficult, I have to decide if I want just the top half to be playing the harder part and the bottom half to be playing the easier part, because I have to recognize that if we want to put on a good performance, I have to play to the strengths of my team, which is the bass section, and I have to use my knowledge about them and about the music to make the performance as good as it can be. I guess this has also occurred in chamber orchestra, where it's I'm the only bassist and we have only a few numbers of other string players. We have gone to several events and played for dinners, for social functions with the school, and also with other events not with the school. And it has been up to me a few times to decide where we should perform, and maybe even how the order of our pieces should be. And it's important to know which pieces we should play, because I know that lots of the people in the chamber orchestra prefer to play the pop songs, because we do have those for weddings and I guess I think we played at a few graduation parties once. Yes, we did. So it's important to know what kind of a setting it should be and what the music what atmosphere the music creates.
Okay, great.